Hello and welcome to this presentation. My name is Alexandra Mina, and today I'm going to present the main insights and results from the analysis done to the influenza mortality. The main goal today is to use the conclusions to prepare for the upcoming influenza season. As you probably know, seasonal influenza, also known as flu, is an acute respiratory infection caused by influenza virus. Influenza spreads easily between people when they cough or sneeze, and most people recover without treatment. However, some people, particularly those in vulnerable populations, could develop serious complications, end up in the hospital, and in the most severe situations could die. Usually, there is a season where more people than usual suffer from the flu, and hospitals and clinics need additional staff to treat the patients. The goal of this analysis is to help medical staffing agencies to provide temporary frontline staff such as nurses, physician assistants, and doctors to hospitals and clinics based on their needs. We know if a hospital is adequately staffed, it has a major impact on the quality of care of both the incoming patients and the pre-existing patients. Not to mention the quality of life of the medical staff that is already at the hospital. So today I will answer questions like when will more staff be needed? Who is most vulnerable population group? And where are the states most at risk? The primary data used to the analysis is influenza deaths by state. The data source is CDC, Center for Disease Control and Prevention, through the US National Center for Health Statistics. There is an important data limitation to share with you. CDC don't record number of deaths under 10 by mouth and state. Um, the analysis period is from 2009 to 2017. And as you can see here in in this line chart, the total number of deaths in US is on average 70,000 people per year. When we split the population in two groups, people over 65 years old and people under 65 years old, we can see a significant difference in terms of number of deaths. Here, around 45,000 people per year, and here in this group, less than 30,000 people per year. And when is the influenza season? Influenza virus circulates all around the year and causes deaths. However, we can see in this chart a very distinct season between November and March. Um, this trend is pretty consistent all over the year. So if we look here, for example, to 2014 data, what we can see is an increased number of deaths from November and then this decrease after March. Same if we look to the states, we see a similar trend. So, for example, if you go here to California, what you can see is an increasing number of deaths from November, and then after March, a decrease and some stable number of deaths in the summertime. Um, Here, this below in this chart, we can see four different regions: Midwest states, Northeast states, South states, and West states. As you can see, the the trend is exactly the same. So in November, we can see an increase and higher number of deaths until March. After that, decreasing and some stability. Um, the following question is about who is the most vulnerable people. Overall, in the analysis period, more than 650,000 people died from influenza flu. And as you can see here in this bar chart, younger age group have lower deaths, and when we look to the older age groups, we can see bigger bars. That means more people died from flu in these specific age groups. On the right side here we can see the relationship between influenza deaths um, and the population group over 65 years old. All these data points are very concentrated and close to this trend line. So this specific statistic analysis shows a strong and positive relationship between these two variables. So we can conclude that population over 65 years old is the most vulnerable people group in the US population. Now it's time to take a look to the distribution of deaths within the vulnerable group identified, so people over 65 years old. In this map, we can see all the US states. The yellow ones are the states with few number of deaths, and the brown, reds, and orange ones um, represent the states with higher number of deaths. So what you can see is California and New York are the states with higher flu mortality, and Texas, Pennsylvania, um, Florida, Illinois represents the second important group of states in terms of mortality. Before jumping in the recommendations, let's talk about the forecast for 2018 and 2019. What we can see here is the future estimated number of deaths, and we can see that are pretty consistent with the previous year. So high number of deaths between November until uh, March. This allows us to say for the upcoming season, 2018, the temporary staff needs to be adjusted to the expected number of deaths for each state. And finally, we arrive to the conclusions and recommendations. So, with the statistic analysis, we identify the peak of influenza, and the peak happens between November and March. The population over 65 years old has a higher risk of dying from influenza, And the states with larger population over 65 years old have a higher number of influenza deaths. So the temporary staff will be higher from November to March, and in particular in states with higher number of people over 65 years old, like California, um, the Texas, Florida, Illinois, Ohio, Pennsylvania, and New York. Um, we also want to monitor the staffing plan, mainly evaluate the success of the implementation plan. And with relevant importance, we want to develop and promote a vaccination campaign against influenza flu with the goal to reduce the mortality and at the same time reduce the staffing needs. This allows us to send staff to other areas like surgery, cancer treatment, and other relevant units. From my side, thank you so much for your attention. If you have any additional questions or doubts, I'm at your disposal to clarify it. If not, feel free to reach me out after this presentation if anything comes. Thank you so much for your time.